All right. Good afternoon, everyone. This is the Return to Work Staff webinar. My name is Patrick Norton, Senior Vice President and Chief Operating Officer of Tulane University. So before I get started, first of all, I just want to, we've been 4.5 months into the pandemic, and I really want to start by thanking everyone for all the hard work in maintaining and sustaining our campus throughout those 4.5 months and really leading up to our return to work model. We're having a series of webinars with the general population, faculty, staff, and students over the week to really unveil and really to articulate our return to work plan. And I'm joined by an esteemed group of panelists. And maybe just give a wave when I mention your name, please. We have Shantay Bolton, VP and Deputy Chief Operating Officer. We have Jason Chretien, the Interim AVP of HR and Institutional Equity. We have Scott Timms, AVP for Campus Health. And Kelly Venable Carroll, Assistant VP for Facilities. And there are Kelly Stockwell, Eric Allen, and Will Furbo's from the President's Office, who have joined us as well to field questions. And there will be an opportunity to ask questions through the Q&A, and we will get to them later. But I'm going to take a few minutes discussing our return to work plan. And I always like to start with, and folks are starting to tire of this, but I don't think you can say it enough, is the 4 golden rules of how do we contain this virus, right? And how do we contain the transmission of the virus? And number 1, and by the way, these are not my golden rules. These are golden rules that were set forth by the CDC months ago, and they're still relevant today. And much of our plan points to these golden rules. So the first one is masking and face coverings, right? So masking and face coverings. Number 2 is social distancing. Keep that required space between individuals. Number 3 is hygiene and cleaning. Not only personal, but also cleaning of your workspace. And lastly is symptom checking. And then undergirding all this, and it's foundational to Tulane, and foundational to many institutions, is our model around testing and tracing. And we have Scott Timms here to talk about our testing model and our tracing model. But let me go through each one of those golden rules and how it pertains to our back to work plan. So masking and face coverings are required when you're in public spaces, indoors or in your office with others. So if you're in a public space, whether you're in a lobby or whether you're wear your mask, wear your face covering. And if you're in your private office by yourself, obviously you can loosen that. But if you're in your private office with others, you have to wear your face covering. In outdoor space, it's strongly recommended that you wear your face covering, especially if you cannot socially distance, right? But if you're, mowing the grass and there's somebody, the closest person is 100 feet away, while we recommend that you wear your mask, at times it's not required. But we'll be learning along the way. But once again, inside public spaces, wear your mask. Private offices, you can relax a little bit unless you're with others. If you have an issue with complying with the masking rules, please reach out to your supervisor and your HR business partner. This is mandatory. We have to comply with masking. It has been known to reduce the transmission of the virus. It's been proven now, and it's required for Tulane. Number 2, social distancing. So we've made a number of investments and a number of initiatives in dealing with the distance between individuals. So it starts with the arrival center. So when our students come to when they come to New Orleans to move in, they are not moving in right away. They're going to an arrival center downtown. We've rented out the entire Hyatt Regency, and they're going to come in through one entrance, be temperature checked, and then separated from their parents. The parents are going to come in. They're going to check in for themselves and their child, and then the child will be whisked away to be tested. And once again, Scott will go into the details around the testing protocol. We have 10 stations that one of them they're gonna go through, get tested, join their parents, go to their room, and then wait for the results, which should be within 24 hours, possibly 36, but certainly within that time frame. So and it'll be, the distancing is that they're not going to come and just move into campus right away. They're going to wait for the negative test, and then they will move into campus. We want to make sure that negative tested individuals are moving into campus. Once they're on campus, and once we're all on campus, classrooms. So we've actually gone into classrooms and ensured that there's enough social distancing, enough physical distancing in these classrooms. And so we've worked with a consultant to help us think through that. And we have made sure that all of our classrooms really adhere to the 6-foot rule. And we've embedded technology in all these classrooms to allow for not only just a good way to transmit the education in that classroom, but also to allow for remote capture of instruction when we need to transmit it to folks that are working remotely. We've erected 13 temporary structures, 13 classrooms that can hold between 50 and 80 students. And they're quite remarkable. We'll be getting some footage up once the weather clears a bit to take some drone footage of it, but it is quite remarkable. It's on the Monroe Quad, on the Berger Family Lawn, and also on the Newcomb Quad. We're also erecting 5 tents. So we have 13 temporary classrooms, by the way, with technology and furniture and seating and HVAC. And then we're gonna have tents erected that are mostly for the performing arts, but maybe there'll be some classrooms as well. So 18 new structures to allow for physical distancing and allow for some outdoor air to come in. And then lastly, we have a temporary structure around dining. So we're gonna, it's called the dining pavilion. It's in addition to the commons, because the commons, thank goodness we built that last year, 1,000-seat dining hall. Obviously, in this world of COVID, we need to physically distance, socially distance. So there's going to be around 400 to 500 seating. We're going to take that seating down by half. So we've actually built a temporary structure for dining that's going to hold up to 299 seats, individuals physically distanced. Next, workspaces. Once again, our consultant came through all of our workspaces. We're certainly working with department heads and looking at the layout and have looked to make those spaces socially distant and also install plexiglass where needed. And lastly, and there are probably more items, but just want to touch on these briefly, is on the shuttles. The shuttles, those are going to be socially distant shuttles too. There'll be distance between the first rider and the driver. And then there'll be seating, socially distant seating in the shuttles. Everybody needs to be wearing masks on the shuttle. So 2 things, wearing a mask and being socially distant at the same time. So that's the number 2 principle, socially distanced distancing. 3 around hygiene and cleaning. So there are going to be hand sanitizer stations everywhere. They're up now. You kind of can't move without falling over one. They're everywhere. PPE is being delivered to everybody. So I have some hand sanitizer and some wipes in my office now, along with the 2 masks that I was given. So just reach out and you'll have those PPE delivered to your office. There was a deep cleaning of all campus buildings by our contractor. And there'll be continued cleaning of spaces, especially the common spaces, throughout the year. Okay, so hygiene and cleaning, that 3rd golden rule, very important. So wash your hands constantly, use sanitizer. We have a fair amount of supply, so don't skimp on that. And lastly, one of the last kind of golden rule is symptom checking. So we're expecting folks to check their symptoms every day, and there will be an app that's going to be rolled out tomorrow that you can put on your phone that you can check your symptoms, and it will tell you whether you need to just keep monitoring or to contact your healthcare provider. You know, the symptoms are basically if you have a fever of 100.4 or greater, you have a loss of sense or smell or taste, you have a cough, you have aches and pains, you know, those are signs of potentially having COVID. So we would expect you to right away is contact your healthcare provider if you exhibit those symptoms. But you'll have an app on your phone that kind of guides you through that. And of course, don't come to work if you exhibit any of those symptoms, right? If you have a fever of 100.4, don't come to work, right? and certainly contact your healthcare provider. And by the way, that should go pre-COVID, right? If you are not feeling well, don't be a hero, don't power through, but please, please take care of yourself and your family, and certainly your colleagues at work by not spreading, whether it's COVID, whether it's the flu. We should always be doing that. Now, undergirding all this is our testing and tracing model, and we're fortunate that we have a world-class school of medicine that is standing up the kind of the testing, and then of course Scott Timms and his great group is funneling people through the process. Both, so all students, faculty, and staff will be tested for COVID. We have now 2 testing centers. We have an uptown testing center, which is located at Patterson Hall. That's been turned into a testing center. The expectation is there's a 24 to 36 hour turnaround, hopefully within 24 hours, maybe even sooner, turnaround of the test results. And I'll let Scott talk about that in a moment. Need a negative test to return to campus. So you need a negative test to be on campus. If you're positive, you'll need to isolate until you are negative, right? Isolate and take care of yourself. Isolate, and if you start having symptoms, take care of your symptoms, and of course, work with your healthcare provider, but you'll need a negative test to come back to campus. We will be doing surveillance testing throughout the semester. We'll be testing our community, about 5% a day of our community, roughly, a little less than 1,000 tests a day throughout the semester, and it'll be a combination of students, faculty, and staff, and if you have a positive test during the surveillance process, if you're a student, then you will be isolated in the infirmary, and we'll care for you there. If you're a staff person or faculty member, of course, you would isolate in your home and would not be able to return to campus until you have a negative test. So those are broad strokes about what we've done to get ready for our return to campus. I think we've invested a lot. People have done really a lot of hard work. We're still open for feedback on things we might have missed. We have an expert group of panelists here that can answer some of your detailed questions. For example, getting questions about HVAC and airflow, and there might be more questions around the actual return to work of staff, which we have certainly Jason Chretien and Shantay Bolton on the line to answer those questions as well. But now let me turn it over to Scott Timms, and gonna go out of sequence here before we get to Q&A, and have Scott kind of describe to us what the testing process would look like, and then if there are positive cases, what the tracing process looks like. Scott?
Sure, thank you. So we are in the midst of testing the new testing program and pilot testing emails and things right now. So it's kind of an exciting piece. But beginning tomorrow, there will be a general communication to all employees and students about how this process will work, which is essentially everyone will receive an email with directions to schedule your test at one of our testing locations, either uptown or downtown. There are extended hours and Saturday and Sunday hours at the testing centers. You'll select the time and the date for the test between now and August 18th, based on when your return to work is scheduled. Show up, there'll be a collection process. We will receive those results in 24 to 36 hours. And you should receive those results electronically via email. That system is being tested today. So the email should start going out so you can select and make that process tomorrow. On August 19th, we start this process over, and we'll test about 5% of the Tulane community every day. And it'll be a random sample of people from all over. So if you are just tested this week, you probably won't be tested till about a month from now, but we'll be testing randomly across campus, again, looking for any potential infection that might be occurring. And in addition to that, just again to reiterate, we're looking at all of this data comprehensively. We'll be collecting data every day from the symptom tracker. So you'll get a text, all staff will start getting that text message tomorrow. We'll be able to respond with symptoms. We'll be monitoring to see if we see lots of people in Sharp Hall or Gibson Hall reporting that they have fevers, and we might change our testing paradigm based on that because we are worried about there being infection there. For positive test results, you'll get an email, but you'll also get a phone call from one of the 3 new contact tracers that we are hiring and training in campus health. The contact tracers will reach out to anyone who tests positive, figure out who might be else need to be tested because they were around that person within the community. So if you are an employee and you work, I'm going to go back to Gibson, and let's say we have another person in Gibson who tests positive. We'd look to see who the immediate contacts would be, or close contacts. And close contacts for contact tracing are people who've spent more than 15 minutes together and are closer than 6 feet. So if your environment is such that you're never around anyone that close, then there would be no close contacts. But the contact tracers will collect that information, notify the individuals who might have been exposed, and coordinate them to get into testing. They'll work with the positive person to do symptom tracking and monitoring so that we can get medical clearance for them to come back into the office. There are some very well thought out, very clear protocols based on CDC guidance. We will do everything we can to protect health information. We're not doing automatic notifications to everyone in an office suite. We won't share any personal information. Only what's necessary to help HR processes like FMLA or workers' comp actions if necessary. So lots of good protocols, a lot of detailed information for that on the website. I would add just a couple of pieces. Other things that we're doing related to testing is we have a wastewater monitoring program that will go into place in a couple of weeks, done by our faculty members in School of Public Health. That also gives us an opportunity to detect COVID outbreaks about a week early. So we're excited about that as another early indicator of what's happening. On our website now, there's a series of alert statuses based on what actions we might take based on what's happening both in the city and on campus. And so we're looking at a variety of factors that might influence our decision to change some of the operational status of the campus. So check those out if you haven't. We also have a new illness reporting form. So if you are tested off campus and get a positive result or think you might have COVID, use that illness reporting form to let us know, because we would still want to do contact tracing and work with you to make sure you have the needed resources. So thanks.
Thank you, Scott. And I see one question that I think I want to answer right off the top. Has to do with face coverings, and it says, it is my understanding that face coverings while you're in your office space was not needed if you're at least 6 feet away. Can you please clarify? Yes, if you're in your private office, no one else in it, yeah, absolutely, right? Door closed, you don't have to wear your mask. But if you're in your office space, in your suite, and there are others that you can run across, yes, you have to wear your mask. And if you're like me, you're just hanging around your neck, and you're just gonna move it up when you go outside. But it's easy to do, but it's required. So if you're in a common area, you have to mask up or put a face covering on, full stop. So Carrie, I think we're ready to.
Okay, following up on masks, there was a question about type. Is there going to be a mask type requirement, such as Disney World just excluded the kind with the exhale vents?
Our recommendation for face coverings is based on what CDC guidelines, which is basically a square piece of fabric like this. The university is providing 2 masks that meet that criteria to every employee. Departments can order those through SciQuest. Those directions went out earlier. There are all sorts of masks. The simpler, the better, quite honestly. We haven't made any decisions to ban any of the KN95s or those ones with the vents like you're mentioning. But again, what we are looking for are square cloth primarily, or what people are using. Face coverings is what we recommend.
Okay, there's a question about the type of test. What type of COVID test will be given, the short swab or the full swab that goes further into your nasal cavity?
Probably one of the most popular questions. If you were tested early on, it was a Q-tip that felt like it was about that long and made you very uncomfortable. The new swab, the test that we'll be doing in the testing centers, is a shorter swab. It actually swabs just the lower part of your nose. 10 loops, 10 circles there. It's not bad. I was actually tested on Thursday. I didn't even sneeze from it, and I was really worried. But it's a much less invasive, much easier swab. We actually are going to have you self-swab. There's a video that you'll watch. You'll have someone trained to watch you and instruct you on how to do it. So you'll have a little bit more control, and it's a lot more comfortable than it was when we started.
Okay, just a couple more questions on the testing. I'll bundle two of them together. Will staff continuing to work from home also participate in testing? And also, where is downtown testing for staff?
So when the emails start to go out about testing, if you are working remote only, or if you're a student who's chosen to do a remote option, we're going to you will be able to opt out of that as long as you're not coming to campus at all. There will be directions on the email instructions that go out. So if you are in a remote status and you get an email from us, you'll have a way to email and contact us, and we'll take you out of the rotation. The downtown location is moving, and so that information will come to you in the emails as it's notified. They've been doing testing out of the old School of Medicine bookstore, but next week it's going into the permanent location. But watch for that in the email directions. But my understanding is a central location. It's a short walk from any of the buildings that are there. And I believe it's in one of the parking garage basements or something to that effect. So.
Can I emphasize a point here about staff members who may be working remotely? Please understand that if you are going to be on campus, whether that's 1 day a week, 1 day a month, if there's any reason that you're coming to campus to utilize your normal office location, any of the public common areas like the LVC or other locations, you have to remain in the testing queue. So I just want to make sure we're very clear with everyone that if you're going to work 100% remotely and you have no reason or no need to come to campus, then you will have the option to opt out. However, if for any reason you're on a staggered, rotating, or some type of alternative schedule that requires you to come to campus, you must remain within that testing schedule.
Yeah, next question. How are staff with high-risk conditions being addressed? Will human resources assist in their return?
Jason?
Yeah, I'll take that one, Carrie. Yeah, we ask, first of all, that employees who have these sorts of concerns speak with their supervisor. We have established an interactive process whereby we go through an evaluation in coordination with your supervisor and an HR business partner to assure that there are, if there's an ADA need or an FMLA need, that we're addressing those needs first and foremost, but also throughout the entire process, remaining as flexible as we can to provide and support students where, or excuse me, not students, staff where possible.
Okay, another question, is COVID leave still available for staff?
Yes, COVID leave still does remain available for staff in very specific and very limited cases. It's going to look a little bit different than what it looked like coming into COVID. So if you were to revert back into March, it's going to look a little bit differently than that, but we'll provide additional instruction as we move forward and progress to the next steps there.
Okay, next question. If you are staff and have to self-isolate after being contacted by a contact tracer, what are the options for that staff member in terms of being enabled to work from home? Or if the position doesn't translate well to work from home, what options are available?
Carrie, you must have known that that was the segue question. So first and foremost, if an individual's job allows them to work remotely, we want to be able to support that employee working remotely in so much as we can. If, for example, they have a role that requires them to be on premise, on campus, thus they can't do their job remote, that's when we would go back to that COVID paid leave as an option to support pay continuance for those employees impacted.
Okay, next question is about travel. What is the expectation for staff asked to travel to other states if they are uncomfortable doing so?
Yeah, no, I think so. Yeah, so let me jump in on this one, and then maybe Shantay wants to jump in as well. But right now, obviously, non-essential travel is still not allowed, right? So it's got to be essential travel, and those travel requests actually have to go up through myself and the provost for approval. So I would say, yeah, I mean, if it's not essential travel, that's not on the table. And the question is essential travel. And I would say if you are uncomfortable, have that conversation with your supervisor for sure, that you feel uncomfortable going to a state that maybe has a resurgence in the virus, et cetera. So just, yeah. Shantay, anything you want to add?
Yes, you touched on all the points I wanted to emphasize. We are still under restricted travel. We only want employees to have to travel if it is absolutely necessary. There is high scrutiny in terms of looking at those travel requests. We have engaged in that since the onset of COVID, and we will continue that until further notice. Also, we are going to be working with managers to make sure that in the event that an employee has to travel, let's say, for example, in admissions or advancement, those type of jobs tend to have to travel a lot, then we want to work with the managers to make sure that safety protocols are still adhered to and monitored, no matter where it is that you are going. However, if an employee is uncomfortable or have some concerns, they should express those with their supervisor. And if for any reason they're having difficulty in having that conversation with the supervisor, that's where your HR business partner comes in. We are having candid conversations around how to make sure that we provide multiple pathways for you to feel supported as we navigate through this.
We have a question about the survey that went out last week regarding elementary schools starting virtually. Are any provisions or processes in place yet to help parents who need to be home to care for young children or who cannot go back to school or daycare?
Yeah, so we're actually analyzing that data now, and I think we'll get back with some possible solution. It's just tough, right? With schools starting virtually, and it happened pretty quickly, virtually, and at least until Labor Day. Obviously, folks that have been working remotely will be able to do so. I understand it might be hard to work remotely when you might have a 6 or 7 year old running around. But we got to do the best we can. It's for those individuals that have to be on campus that we're most concerned about. So we're going to analyze the data and probably coming out with some type of solutions if possible within a week. So just hang tight for a little while longer.
Okay, next question is about cleaning. Who do we reach out to regarding creating a cleaning plan for our spaces? And how can we get the results from the consultant on how many people can be in our offices and workspaces?
So Kelly, you want to take that one?
Sure. So we have developed cleaning protocols in conjunction with our industrial hygiene consultants, JS Held. If you though want to send me an email separately to discuss what department you're in, and if you have concerns about the cleaning protocols, I'd be happy to work with you. Department administrators were provided the results of the space assessments. So if, again, you don't know what your results are, just reach out to me via email and I'll be happy to discuss with you.
Okay.
Next question is about shuttles. Given the reduction in seating, will there be more frequent shuttles or multiple shuttles on the same route?
Kelly?
We're still working through that because obviously we don't have enough capacity with the equipment that we have. So we're working with New Orleans Tours to see if they can assist us with increasing the capacity.
So work in progress, but we understand that this might be an issue. Thank you, Kelly.
Okay, next question is about mask wearing. How will that be enforced? And what if my coworkers are not masking correctly and making me feel unsafe in my work environment?
Yeah, so let me jump in, Shantay, and then you'll add some details. But there is certainly the willful non-compliance is probably the easiest piece to deal with. It's mandatory, based on the regulations except for the mask wearing and wear. It's required, right? It's required from a staff, right? So the willful non-compliance, I would say, just go right to your supervisor, and then the supervisor will go right to HR, and then that will be dealt with. There's also been an education process, right? So some of us, early on with mask wearing, I mean, who didn't leave the house, get in their car, drive a few blocks, and realize I forgot my mask, right? Or I didn't have a mask in the car and had to drive back and get your mask, go to the grocery store or somewhere else. We're going to allow for that, of course, an education process. Can happen 20 times, and we're wondering what's going on. But it will happen where it's an education process, right? We're not going to expect TUPD to be involved in these, in adjudicating these issues. It's going to, if it's a staff person, it's going to be really handled within HR, between supervisors and HR and really the HR business partners. If it's students, it's going to happen within student life. And if it's faculty, it would happen, of course, with the provost's office. But those are the areas of adjudication. But we expect people to comply. But once again, if they're not, we will come in with enforcement. Shantay?
Yes, I wanted to just emphasize a couple of things here. One, behavior change occurs over time. This is a pandemic, and so we've been thrust into more rapid need to change our behavior. We want to work in partnership and collaborate across campus with our employees in this behavior change and try to give them tools, education, and resources to be able to facilitate that. With that said, all employees will be required to complete a mandatory training prior to returning to our campus, in which an aspect of this will be highlighted and the importance of face mask coverings. In addition to that, there are a few pathways that we've created for you to be able to address concerns if you see them. One, if it is appropriate and you feel comfortable, it's okay to say, hey, you know, Jane Doe, John Doe, you forgot your mask, or remember we have to mask up, right? Sometimes that's not feasible or possible, or some people feel uncomfortable with that. You have your supervisor as a second line of defense. The supervisor also is very well versed, and we're working with them, with the business partners, to be able to understand how we can address that. I will tell you, the idea is not that a person is not going to have on a mask, first offense, and we fire them. That is not where we're going with this. What they will be required to do is to go through the mandatory training again. They will have a consultation, and if we see that that behavior persists, it can lead up to and include termination. So I don't want to be transparent and honest with you all. We are taking this extremely serious, not only on the student side, but also from the employee perspective. We have a responsibility to one another in terms of this public health crisis, and we have to all play our part. And I'll tell you, having sat through a few meetings that were 9+ hours with the mask on, it's not as bad as people may think, but we have to take personal ownership and also shared ownership for each other's health and welfare when we're on our campus. So it will not be tolerated that people will just dismiss this mandatory mask wearing. In addition to that, there is a commitment to public health form that all employees at the end of their mandatory training will be required to sign in order to successfully complete the training. It will detail out what these expectations are and the consequences should you fail to abide by that. And so it's our way of just trying to reinforce the importance of this, what your role is, what resources you have available to you, and if you should not abide by it, what are the consequences you can expect?
Yeah, let me just thank you, Shantay, and just to reemphasize what I said earlier, and Shantay, there's a big difference between willful non-compliance and an innocent, just forgetful, I forgot to wear my mask. Big difference. So thank you.
We have a question about returning to work. Should we now know our assigned return date, or if we've been approved to work from home? And will offices be phased back to work, or is everyone expected back on August 18th?
Jason?
So Jason.
Yeah, we're currently staging employees to return in various groups. Our focus right now are for those functions that are student-facing. If you are unclear as to your return date and you're in a function that is student-facing, by all means, have that conversation with your supervisor. Likely they are already beginning to stage and prepare for the return of the population that's needed to support that department's function. You may quite possibly be in a unit that's staged later, say into phase 3, and that date may not be set as of yet. That's okay. We're working through the groups. There's a lot of people and a lot of steps that we need to get through, to include not only the elements that we spoke about earlier relative to the testing and the training pieces, but there's also the assurances that the workspaces are ready for you to return as well. So there's a number of steps in that sequence. But first and foremost, check with your supervisor to make sure that you're clear on what that anticipated return date is.
Next question is about contractors. How are we dealing with non-employee contractors? I'm dealing with several due to classroom enhancements and building repairs. Will they be tested and under the masking requirement?
Kelly?
Yeah, everyone who comes onto our campus, particularly working in our buildings, is required to wear a mask. We get a lot of reports of people who are not masking, and we take those up with whoever is managing those contractors. As far as testing, that's being done by the individual contractor's company, but they do, when they come on board as a university contractor, have to sign off that they are going to follow all the protocols and policies set forth by the university as it relates to COVID-19.
Thank you, Kelly. And just to add, our contract, the contract individuals in Sodexo and also Allied Security will be tested by our testing regime, because they are so interrelated to our campus and the dining and the custodial and the security area. So they will be tested as they come to campus.
There's a question about elevators. Are there guidelines for staggering hours for buildings like Tidewater with limited elevators and the potential for bottlenecking while waiting for elevators? I know stairs are an option, but for people on high floors, it's not feasible.
All right, going to Kelly again.
So the buildings downtown that are high rise, public health in particular, those facility administrators are working through that. I know they've started to make some designations on which elevators can be used to go up to the upper floors, whereas certain elevator banks are for the lower floors. So we're leaving it up to the individual schools and facility administrators, because obviously they know their business functions and day-to-day better than we do. And so we're leaving that up to them.
Okay, next question. Sorry.
No, go ahead.
Next question is about student employees. How should employers of student employees manage students being tested before coming to work? We can't ask due to HIPAA. Will this information be shared with us from the university?
Jason? Oh, no, I'm sorry, Scott, go ahead.
Can you repeat that question, Carrie? I missed the first part.
Sure, it's about how to manage student employees being tested before they come to work, due to HIPAA rules. Will the university let them know?
So if we'll be managing the process for getting everyone in, and we'll be activating the process if they are not compliant with testing. We've worked with student conduct around protocols for that. So there are processes. We're not really asking the supervisors to manage that themselves. It's a university and a centralized process, and we would take any necessary actions with the students should they be non-compliant with testing.
Okay, while we're on the testing topic, 2 questions that I'm just going to put together. If we've been tested within the past 2 weeks, can we submit those results to return to campus, or do we have to take the test on campus? Is any testing center okay, or does it have to be the Tulane testing center?
It has to be the Tulane testing center. Now, if you were tested at one of the Tulane testing centers and you get an email, you'll have instructions to let us know. We'll try to match it up. One of the struggles that we've had is that we've had 2 testing centers operating without a centralized management system as we were implementing that over the last few weeks. So it's a little bit fragmented right now. I've seen several questions about time. Sometimes it's quicker, sometimes it's slower. And right now that's because the systems are not combined. That's happening right now as we speak. And so we'll have all of those results in one place, and the turnaround time should be consistent for everyone. So if you were tested off somewhere else, I can't do anything with that. You have to use our system. If you were tested at one of the Tulane sites, either uptown or downtown, you can provide us those and we'll try to update. We have that information. We're trying to do catch up and data entry with it. But if you've got it handy and you get a notice that you're due for testing, you can email it and it might speed up the process.
A couple questions about shared workspaces. What are the procedures for shared workspaces? Will they be sanitized every day? And in an open floor plan situation, will there be plexiglass provided either around their desks or as you walk into the office space?
Kelly?
Yeah, so if you work in a shared space or shared environment, the first recommendation is to flex your schedule if possible, so that maybe you work different days or different times. If that's not possible, then it's a rearranging of the office. And then if that's not possible, then it is installation of plexi. So if we haven't come by your space, or if you don't have plexi installed or on order, please reach out to me so that we can make sure that you do get that ordered. We are really focusing on reception areas. So the front office staff who have a lot of people who will be standing at their desk or even passing their desk need to have plexi installed. And then even in shared environments where maybe you or in student services and you receive a lot of students in your office, we need to ensure you have plexi as well. And so Patrick, just to touch on some of you said earlier about somebody asked about wearing masks. If you are in your private office, but you're receiving visitors or you're meeting with students, both of you are going to be required to wear masks and practice 6 feet social distancing.
Yep.
Next question. The numbers in Louisiana are actually higher now than they were when we first left campus. Would there be any point where we might have to leave campus again?
Yeah, the good news there is, and you know, every day is a journey, right? Every day is a journey with these statistics. Is the numbers seem to be plateauing and maybe decreasing. But if it, you know, you have to look at the 5 to 7 day averages. At this point, we're looking to reopen certainly in a couple of weeks. Students coming back, and as far as you know, and we're bringing staff back over time. And so at this point, there's you know, we're watching the numbers closely, and we've made every investment and every plan to keep our communities safe. So feel very comfortable about that.
Question about students living off campus. Will students who do not live on campus and therefore will not go to the arrival center process be tested prior to their arrival on campus?
Yes. Go ahead,
Yeah.
Scott.
The testing protocols, all of the health protocols are the same for both off campus and on campus, graduate professional students as well. We have a different time frame for them because they're not starting class. So we have a little bit of a different runway, but they will be getting the same communication starting this week about scheduling their appointment for testing.
With states experiencing a positive testing rate of 5 to 14%, what's the protocol if we exceed the space available in Patterson for quarantining students?
So we've actually worked with a couple of our faculty members in public health, and I'll give Patty Kissinger and Richard Oberhelman a lot of credit because they helped us develop a spreadsheet that based on positivity rate, the number of students that live on campus, how much capacity we need in the infirmary, and how much hours it would take to do contact tracing. And so we feel pretty confident that we have enough capacity to get to a pretty good positivity rate here, about 5%, and would be able to manage that. Patterson is not the only opportunity for isolation and quarantine space. Many people would choose to stay in their own home. If it's a student that lives off campus, they don't have to go to Patterson. Likely the entire roommate there would have been exposed, and so we may allow them to stay there because it might be the most comfortable place for them. We also have some and are working on a plan with some of the other local hotels for overflow space. We have a lot of options for that, and so there are plans and directions. There's also a lot of flexibility. So again, if we had a residence hall outbreak and it was several floors and sharp, it would be better for them to stay in their own space. We could take care of them there versus relocating them out of that building. So there's a lot of opportunities. It's not just isolation and in the Patterson Hall. We really look at it as a very holistic approach about where we're going to plug and play people on what's best for them and what space is available.
Question about campus access. Since this is a campus in a city, how will we handle random campus visitors or walkthroughs? Yeah,
so I'll start with that, and maybe Kelly, you'll jump in. So what this is going to be, if all our facilities will be closed to non-Tulanians. What I mean by that is the LBC, the Commons, our classrooms, our library will just be off limits to folks that are not part of our community, that haven't been tested. So that's pretty straightforward, and there'll be enforcement around that, and there'll be a fair amount of signage around that. Now there's going to be the potential walk-through, the drive-through, the bicycle through, you know, that's going to be what it is. But for the, and that's fine as long as they're on their way from here to there, and that's through our campus. But we're not going to allow for individuals that are not part of our community, that haven't been tested, that haven't been in our contained environment, to congregate, whether it's inside or actually outside as well on our greens. We'll be taking a fair amount of measures, and just not only signage, but also other activities as well, other enforcement activities to ensure that we keep a safe campus. Kelly, anything you want to add?
No, that was correct. Thank you.
I would add that one other piece to that is a change is that students from other campuses can't take classes here this fall. We've had some open programs where Loyola could take classes here. Those programs were closed to reduce that to our students, and so there are no programs like that. I think there was only one exception for ROTC, and we're actually testing everyone in ROTC to accommodate that need. But in every other circumstance, it was closed.
And Scott, in addition to that, we've exchanges with dining halls that will stop between Loyola and Tulane. So no Loyola students will be able to go to the dining halls. And then also is shuttles. They won't be able to ride the shuttles as well. So it's going to be pretty, we're going to button down our campus as much as we can. We understand about deliveries, but I think Kelly handled that when she talked about the COVID plans by our vendors, our contractors, as they deliver stuff, and also if they're doing contract work inside classrooms, et cetera.
We have two questions about cleaning in offices downtown. The first is that 1555 Poydras is managed and cleaned by another company other than Tulane. Are they cleaning and sanitizing up to par with Tulane standards? And the second question is, how is the HVAC being cleaned in the high-rise buildings downtown?
All right, Kelly.
Yeah, so for our lease spaces, we have been working with them to understand what their protocols are, and they are in keeping with ours. If though in your particular lease space you are looking for something additional, you should definitely reach out to campus services to let us know what kind of additional cleaning or sanitization you might be looking for. As far as HVAC, we brought in some contractors to test our HVAC systems and look at error rate changes per hour, and any deficiencies, we're correcting those. But filters will be changed every 2 months, and we are increasing our filters. So right now we run what's called a MERV 8, and we'll increase that to a MERV 11, which means it will filter out more particulates. And then we'll run a MERV 13 on our newer systems, or where we can run that quality of a filter.
Question from a supervisor. As a supervisor, how do we know if an employee has been tested and their result?
So you could ask them, but otherwise you wouldn't be notified. That information is protected. We won't be providing them, they don't have like a proof to show you that they've done it. If they haven't done it, we'll be notifying HR, and the HR business partners will be working with them on any sort of notification that needed to happen.
Okay, we have a question about faculty. Are faculty and other instructors required to wear the face coverings when teaching in-person classes?
Yes.
Okay.
Full stop.
Are there suggestions or best practices published by Tulane for how to approach the conversation if students come into the office without a mask?
Scott.
We have not developed that sort of an education piece. Something we can look at and consider. There's a lot of other education coming out, but I'll take a look and see if that's something that we could do.
Good question.
Scott, can you talk about how graduate students and others, it says others who will be living off campus, which I know you spoke about for undergrads, but can you talk about how they will be welcomed to campus and tested?
Sure. They will be receiving an email from us this week, just the same as the undergraduate students will, with directions on how to schedule a test, a date and a time for their pre-arrival test. And I know that there are some programs, I know law school, I found out yesterday law school starts earlier. We're sort of putting them up in queue to get in earlier. So, but they'll get the same sort of information as everyone else. We have an online course too around COVID safety that graduate students will be receiving from us, similar to what all of our employees are getting. All students will get it. I would just, maybe it's a good statement to say, is that I don't care what sort of student it is, undergraduate, graduate, professional, off campus, on campus, everyone is getting the same access to the same services, same educational opportunities, same sort of expectations for symptom monitoring. So everything is the same for everyone. Service-wise.
And Scott, there's a question. If you have a family member who tests positive, can you get a test through Tulane right away outside of the normal random testing cycle?
Yes. So there's a really great news for us is that there's an Uptown Wellness Clinic opening and a Living Well Clinic, and Jason or Shantay may want to add about that. But if you are a known contact or were exposed or experiencing symptoms, faculty and staff should go to the Living Well Clinic, either the Uptown or downtown location. Uptown will open, I think, in the next few weeks. There's information on the website about how to access that for services, but they will have the ability to do a test for you in that scenario. The surveillance testing program, which is the regular monthly, is for people who are not sick. So if you are sick and you have symptoms at all, don't go to that program. Don't just wait. Well, I know I've got my appointment tomorrow. I'll just go. We don't want people who are sick going to that program. They should be going to the clinic so they can talk to a healthcare provider. Good question.
And the Uptown Wellness Clinic is based off of the demand and the positive outcomes of the utilization from our downtown location. We want to provide support and ease of access for our Uptown employees as well. So they will be providing normal services as they would in the downtown location. So if you are feeling ill or feel like you need to see a physician and you're not able to get into your normal doctor's office, they will be also taking patients as well. And that the information there, I want to reemphasize as well, is also confidential. So they are not at the wellness clinic going to be sharing information with the Office of Human Resources, nor do they share any information with your supervisor or colleague. So it still falls under HIPAA.
Okay, one more question about campus visitors. What are the campus rules around admission and development visitors, such as campus tours, donor visits, and meetings, et cetera?
Scott, do we have protocols on that you can talk to?
Around campus visitors, groups?
Yeah, admissions and development, et cetera. Probably mostly around admission tours, which are starting up soon.
The current group size that we have published for programs is 15. I've seen no requests for anything different than that. Now it's possible there has been some work with some of the campus assessments that have changed that, but right now the group size that we've published has been 15.
And the expectation is that all visitors will be required to wear masks. Families, in particular, to admissions will be required to sign a form that asks them questions around their symptoms. Some of you all probably have experienced that if you've gone into public places, so it'll be a similar form to the contact tracing that we'll use on the app, but they'll have a form you have to fill out. And starting on Monday, their temperatures will be taken as well and logged for all visitors entering into that area.
Yeah, I think that's the key. I mean, temperature checks, which I think we're all going through now and at some locations just in our personal lives, and then masking, and then to Scott's point about the size, and I think we're having conversations about that because admission tours are usually larger than 15. So just stay tuned on that one.
I think that's it for questions, Patrick.
Okay. Well, thank you. Thank you, all of you for listening and for dialing in and all the work you've done over the past 4.5 months to get us to this point. I think, I guess you could tell that we've made a huge investment in time and resources and people time to bring our campus back in just a couple of weeks, where I think we're well situated for that. Please send your feedback in if there's, and I know there are a number of questions that went unanswered. I think we're going to try to answer them in some form or fashion. But thank you for your feedback as well. And be safe, and we'll see you soon.